Welcome back to the Self-Carapist Therapist. I'm your host, Lorraine Moorhead, therapist and consultant. And today we're diving into radically open DBT, a treatment approach that targets overcontrol. My guest is Dr. Ellen Astrachan-Fletcher, a lecturer at Northwestern University's Feinberg School of Medicine, associate professor of psychiatry at UIC, and owner of EAF Re-Center. With over 30 years of clinical and teaching experience, she is a nationally recognized expert in DBT and radically open DBT, and the co-author of 2 workbooks used at eating disorder treatment facilities across the country, with a 3rd book on the way in 2026. If you enjoy this conversation, please follow the show and share this episode with a friend or colleague who would be interested. Welcome, Dr. Astrachan-Fletcher.
Thank you so much for having me, and please feel free to call me Ellen.
Okay, thank you. Ellen, what is radically open DBT or RO-DBT?
Wow, what is it? Well, so radically open DBT is a treatment that actually was developed by Tom Lynch, who honestly was doing research in the development of radically open DBT for now about 30 years, even though the book and the manual just came out a couple of years ago.
Interesting. And you do both. You do DBT and RO-DBT yourself.
Correct.
So what would you say what are some of the main reasons that it was developed from your perspective?
Yeah, great question. So actually, Tom Lynch worked very closely with Marsha Linehan early in his career. And so if you Google him, you would see lots of references to DBT and with Marsha Linehan. And at some point, he moved overseas and he was continuing to use DBT and work with it. And he started recognizing that there were lots of clients that actually DBT didn't help. And so he started kind of looking into what is it that they're needing? What is it that they're displaying? And he really started to look at, well, DBT is developed for people who have pervasive emotional dysregulation, meaning showing their emotions a lot in all kinds of places with all kinds of people. And he was seeing a lot of people who were chronically depressed, having anxiety, things like eating disorders, and they weren't actually showing their emotions all over the place. They actually held things in really tightly. And so when you're teaching someone DBT, which teaches you to control and contain, be more serious, try harder, he was recognizing all of these people actually don't need those things. They need the opposite.
Yeah. So true. Our clients that we imagine DBT being really effective with are learning some containment. And so teaching people who are actually quite probably skilled with containment skills.
Yes, that's exactly right.
Yeah.
Yeah. And in fact, we talk about this, right? Because very often when people are, as we call them in radically open DBT, emotionally over-controlled. By the way, I want to make it very clear that doesn't mean they're controlling. It means that they control their emotions, right? And so when someone leans towards being emotionally over-controlled, they hold things in. They don't share very much. They're not very vulnerable with people. And we often will say, like, so do you think when someone is over-controlled, they ever show emotion? And the answer is yes. And it looks different and it comes out differently, right? So in radically open DBT, we call that emotional leakage when emotions come out. So I often will say to people, because by the way, I'll just tell you right now, I'm emotionally under-controlled. So I emote anywhere. And that's the thing, right? So I will emote anywhere with anyone at any time. So what do you think?
I was just self-identifying as emotionally over-controlled. So we'll have all the samples here today.
Then I'll ask you the questions and you can answer me from your perspective. So where I will show emotion anywhere, anytime with anyone, where do you think people who lean towards being emotionally over-controlled show emotion?
With themselves or in their actions?
So first and foremost, alone by themselves. So, someone who is over-controlled will hold it in and hold it in hours, days, weeks. Keep holding it in. Something happens that pushes them over the edge. They hold it in more if they're in public. They get home. If there are people on the couch, they might beeline to the bathroom, lock the door, and burst into tears, or get into the shower and burst into tears, or go for a car ride alone and burst into tears, right? So it's first and foremost alone. Sometimes, though, with trusted friends and family. And that's when I'm like, oh, lucky us, because we'll get the blast. But it actually is lucky because it means that person trusts us. And that means a lot, right?
Yeah.
And extremely rarely will people who lean towards over-controlled show emotion in public. And when they do, it is typically only due to moral certitude, meaning I need to teach you a lesson. So I might be upset, distressed about other things, but the emotion will come out in, I'm going to teach you a lesson. You're doing something wrong in public.
Mm-hmm. The way that you explain that is begging the question. It seems like people that are over-controlled might think that's the high road, like that's a good way to be, or the proper or a better way to be than their under-controlled counterparts. What do you think?
Absolutely. In fact, there's a forced choice pairs questionnaire, which basically has the opposite traits on different sides of the questionnaire. And a person fills it out. How many do they have on this column? How many do they have on this column? One's over-controlled, one's under-controlled. And an old colleague of mine, gave it to her husband, who is extremely over-controlled. And he said, this test is ridiculous. And she said, what do you mean? And he said, why would anyone mark anything on the other column?
Why would you ever admit to
Exactly.
emoting?
Right, exactly. So, yeah, and I often will talk to adolescents who, if they have one over-controlled parent and one under-controlled parent, I say, what do you think the child ends up seeing as they grow up? And very often, what they will witness is the over-controlled parent constantly judging and criticizing and correcting the under-controlled parent. And they learn, I shouldn't be like that. I should try to be like that.
Yeah.
Right.
Or they maybe even some joining with the over-controlled parent who's judging the
absolutely
under-controlled parent.
Right.
Yeah.
Yeah.
Okay. So just from a DBT perspective, this is I'm just always looking for the scoop, the story. But is there any pushback between DBT and radically open DBT, or has it been are they accepted as two viable approaches?
So I think, radically open absolutely accepts DBT and really views radically open DBT and DBT as dialectics. Like,
Oh, yeah.
we all have different biotemperaments. And, most treatments get developed for people who are under-controlled. And why? Well, there are two main reasons. One is our society says the more control, the better. So if you control, you don't need treatment. You don't need help, right? And the other reason is, what does someone who is over-controlled do when they're in distress? They control and contain it. And they don't ask for treatment. Whereas someone under-controlled is going to cry and yell and scream and demand treatments. And treatments get developed. So this is one of the first treatments for people who are more over-controlled. Although I will tell you very often when people seek treatment in higher levels of care, they are emotionally leaking so much by the time they get into treatment that they actually want skills to control and contain. But if you teach someone who's really really over-controlled to control and contain, their emotional leakage actually gets worse, not better. There are, different camps, right? So there are people like myself who have learned DBT, love DBT, know that it absolutely works with a large group of people. And I am a big believer that if anyone believes their type of treatment is the only type of treatment, they're dangerous. And I say that because humans are way too varied. We are way too different. And there is nothing that can treat all of us in the same way.
Yeah.
And having said that, there are, people in hardcore DBT camp who kind of feel like DBT in its discussion of dialectics covers some of that issue of over-control.
Yeah.
And so there are definitely people in the DBT world who don't believe we need radically open DBT.
Okay.
I've been doing both for decades now, and they're both necessary.
Yeah. I want to give a little context. We had a previous episode that focused on DBT, and I think it was around episode 2. But for anybody hearing dialectics for the first time, it's when two seemingly contradictory ideas exist at the same time. So it's a bit of a both and instead of an either or. And so when I chuckled when you said it's the dialectics of DBT and radically open, it's like the two seemingly contradictory things can coexist, and there's space and need for both. How wouldn't there be from a DBT perspective?
Exactly. Right. Yeah. Yep.
What does it look like when you're seeing emotional leakage?
So this is the interesting thing about emotional leakage, because emotional leakage can look a variety of ways. So when you think about someone who's emotionally over-controlled and they are so controlled and contained, it's kind of like the classic, I'm fine. No, I'm fine. Right? Which they're not, but they are holding everything in so clearly, right? And so in some ways, emotional leakage could just be like, that in and of itself, from an RO-DBT perspective, could be emotional leakage. And it could also be coming home, going to the bathroom, bursting into tears. It could be being on a bus and you're someone who's over-controlled, who has and by the way, rules guide everything when people lean towards over-control. And so someone, let's say, is over-controlled, they're on the bus, and they have this belief that anyone who is under the age of 25 should give up their seat when an elderly person gets on the bus. And sure enough, an elderly person gets on the bus and an adolescent does not give up their seat. And this is an over-controlled person who has been controlling and containing. And they walk over to that adolescent and they might say, did you not see that elderly person get on the bus? What is wrong with you? Don't you know that when someone elderly gets on the bus, you give them your seat? What is wrong? Were you raised in a barn? That's an example of emotional leakage related to moral certitude.
Mm-hmm.
Right.
Yeah, that righteous indignation.
Exactly.
And again, it feels like it is appropriate to come out. Like I've picked a very important time.
Exactly. Right.
To leakage.
And it's not about me or my personal feelings. It's just because you've done this wrong thing.
Yeah. Oh, that's a great example. Yeah. Are there skills in RO-DBT similar to what you would expect from DBT?
Not similar. So radically open DBT really focuses on helping people grow in terms of flexibility. So, it's kind of like, can I respond differently in different situations? Helps us work on receptivity and openness. In other words, in order for us to learn and grow, we have to be receptive and open to feedback and to things changing. And then the final thing is true connection. And true connection, by the way, does not mean like having lots of acquaintances. True connection is, I know this person inside and out. I know the things they're embarrassed about. I know the things they want to hide from other people. They know those things about me. I love them and they love me. And very often, from a radically open DBT perspective, when people are more on the tail end of overcontrol, they struggle from what Tom Lynch refers to as emotional loneliness. And that is feeling totally alone in a room full of friends. That is being surrounded by people who say that they love you, and yet you feel unlovable. And how do you get that way? Well, if you can say to yourself, if they really knew me, if they really knew what I thought, if they really knew what I felt, they wouldn't love me and they wouldn't be my friend. That's how you get there. And then, so what's the solution? It's actually to start sharing your true self with people.
Mm-hmm. Yeah, test it, right? If you share, see, and then either way what their reaction is, but of course, more often than not. But there will be times that people will accept those vulnerabilities that you share.
In fact, when you think about it, it's funny that you say, well, there will be times when people accept those vulnerabilities. When you think about, why are you friends with your closest friend? Is it because she has a beautiful car, or he, sorry? Is it because they have a beautiful house in Mexico? Or is it because it's someone that you can be vulnerable with and they can be vulnerable with you, and you know them and they know you? And so when you think about it, vulnerability is a key focus of our ability to develop close connection. Now, when we talk about that, in this theory, people who lean towards emotional overcontrol have high threat sensitivity, they have high detail focus, and it means that they see mistakes and problems everywhere. And they're often perfectionists, which means, by the way, they believe they have to strive to be perfect. They believe they have to appear perfect, but they never believe they're good enough. So think about what it's like for someone who is a perfectionist to receive feedback. It's painful.
Yeah.
And receiving feedback is the only way we can learn and grow. And so radically open DBT teaches skills. How do I take in feedback, right? How do I be open to things, right? We talk about mind states in radically open DBT. Fixed mind, which is, I don't need your feedback because I have the answers. Fatalistic mind, which is, I don't need your feedback because there is no answer. All is hopeless. And then the flexible mind, which is what we work towards, which is, is there something for me to learn given this feedback, or given my reaction to this feedback? Because am I more likely to have an emotional reaction to feedback that is nowhere near base, or feedback that actually hits home? And so radically open DBT teaches skills about taking feedback. It teaches skills about emotional social signaling. How do we socially signal to people in ways that might get you pushed out of the group, right? In ways that maybe sometimes when people are perfectionists, high detail focus, high threat sensitive, they're experts at things. And they can signal superiority. And sometimes, totally unintentionally, when that gets signaled, it pushes people away, right?
Mhm. What are some other examples of social signaling?
Oh, I mean, social signaling is in and of itself a whole field of research study, right?
Okay.
So, like, for example, this is a social signal.
Yeah. So we've got a good eye roll over here.
Exactly, right?
Yeah. Oh, so it could be nonverbal, it could be passive aggressive social signals.
Oh,
It could be
yes. And in fact, we often talk about how when people lean towards really that over control, they often communicate very indirectly. And the
yeah.
problem with this
Yes.
is often they don't get their needs met and they
Mhm.
don't understand why because they're, being indirect about it. And they feel resentful that they don't get their needs met. And then they believe they're horrible people for feeling resentful. And it's, when the reality is we all need to get our needs met and we can all ask for help, that type of thing.
I think your example of "It's fine, I'm fine, nothing's wrong" was a great one, a great image of this concept because you're saying, in essence, the opposite of how you feel because that feels safe or that feels most comfortable. And then if people take you at face value, at your word, they say, "Oh, she's fine." And then you're left with
Exactly.
this disconnect where you're thinking, obviously, I need something to change. I mean, how inappropriate that something hasn't shifted or that the behavior hasn't changed. But to your point, it was a nonverbal that was clear to you, but no one else could, it wasn't a dialogue that could say, "Hey, would you mind doing this instead of that? That would feel really good." And then
Exactly.
everyone's clear on where you stand.
In
So I can
fact,
see the cyclical nature of things.
oh, right. Yeah. And in fact, there's a whole exercise in the RO-DBT skills manual where it's when an OC says this is what they mean, and this is what the other person hears. So, like when an OC says, "I'm sure that was my fault," what does the other person hear? Oh, they're taking some responsibility. What do they mean? Usually it's that was totally your fault. When someone over controlled says something like, I was a bit disappointed. What do we hear? They're a little bit disappointed. What are they actually saying? They are really, really upset. Right. So a whole practice of that type of thing.
What would you say are some of the skills used to combat that loneliness? Is this one of them? Like to create those close relationships, it's to invite vulnerability maybe and help with that clear communication?
Well, I mean, they're in radically open DBT, there's a novel mechanism of change. And basically it says that, when people lean towards being emotionally over controlled, they tend to have frozen or masked facial expressions and inner feelings, right? So we don't see much on their faces. And by the way, there are two ways that can go. One can be a really flat face where someone never shows much emotion, or one where they show a lot of positive emotion, even if they're talking about their house being on fire, right? But either way, it's frozen or masked. And that gets perceived as untrustworthy or stilted or inauthentic. Then that person is more likely to be socially ostracized because of that social signaling. Then when they get socially ostracized, they feel depressed and anxious. And then it actually leads to more threat sensitivity, frozen and masked inner feelings. So the novel mechanism of change in radically open DBT is teaching people how to have open expression and self-disclosure, how to be open to other people as well. This then gets perceived as trustworthy and genuine. This then leads to social connection, which then leads to feeling safer and secure, which then helps the person socially signal in ways that are more open and with self-disclosure.
Oh, so interesting. I'm thinking about Botox and the rise of Botox and how it affects facial expressions. Um, have you noticed
Oh,
any,
yes.
yeah,
Yeah.
what are your
Well,
thoughts?
I mean, Radically Open DBT talks directly about it
Okay.
because we talk about mirror neurons. And mirror neurons, basically, if I see someone do something, and the more connected I am to them, the more I'm likely to have my mirror neurons firing. I'm going to do the same thing, and I'm going to feel it in my brain in the same way, right? So with those mirror neurons, that's really important. Now, when a person uses Botox, they can't actually micro mimic
Hmm.
what the other person is experiencing. And we actually theorize that this negatively can impact two things. One, your own empathy, because if you can't micro mimic pain,
Hmm.
you're not going to feel it as much. And the second is it makes other people feel weirded out because when we can't read a person's facial expression, it makes us anxious and uncomfortable.
Uncomfortable, yeah.
Yeah. I had someone I was talking about RO-DBT once at a conference, and someone raised their hand and they went, "Oh my God, this makes so much sense. I went to a party in Los Angeles and it was the freakiest party I'd ever been at because I couldn't tell what anybody was thinking."
Oh, wow.
Right.
Really interesting to think about. And as clinicians, we're really taught some of that mirror
Oh, yeah.
neuron piece from early on. And I think if you watched a video of many of us in a session, you lean, I lean, you tip your head, I tip my head. You lean for,
Right.
you make a face, I make a face. And so
Yeah. Yeah.
it's just so interesting to think about the clients or companions, people we meet that we're not able to make that connection in the same way because of that lack of facial expression, whatever is the cause of it.
Well, I can even narrow it down for you in more detail. Just like one example, a very important thing that we teach people about in Radically Open DBT is something called eyebrow wags. It's putting your eyebrows
Raising
up.
your eyebrows. Yeah.
Now, you might think like, okay, what does that have to do with anything? I can tell you, if you want a good laugh, you can watch on YouTube John McIntyre talking eyebrows. It is absolutely hilarious and it drives the point home. But basically, even as clinicians, we learn to feel our client's pain. Like, it's okay. I know I'm with you. And what Tom Lynch and his team learned is that when people lean more towards over control, they perceive that look of concern as I've done something wrong.
Mad. Yeah.
And so in Radically Open DBT, as therapists, we are trained to put our eyebrows up a lot, which expresses openness and curiosity. And I want to hear what you're saying, not that I'm concerned about it.
Yeah. This is so interesting because I hear a lot, um, oh, I got a dirty look, or she looked so upset in a situation where often I'm reading the response as she was engaged. I experienced her as engaged, or I experienced that person as really leaning in and learning and holding space. But I've heard people perceive it as, oh, they looked mad. They were giving me a
Yes.
dirty look. They thought what I said was stupid, or so it is interesting that we I feel like sometimes at the end of the day, I'm rubbing my forehead because I can tell my eyebrows have been so up for so long.
Well, I'll tell you, watch Talking Eyebrows and it will drive that point home for you because
Okay.
it's hilarious. And I used to say to clients like, walk around watching where people's eyebrows are when you're talking to them and notice the impact it has. I have
Interesting.
I have 3 older brothers, And I recently was visiting my middle brother. And he is a very serious, very brilliant, very, competent person.
Sure.
And his eyebrows are always down. And he ended up saying something to me one day, and I was like, Joe, I shouldn't have said his name. Oh, well. I said, you got to move your eyebrows because you're so intimidating, even just because of your brilliance and all of that. But your eyebrows are flat and it just scares people. And he was like, really, Ellen? And I was like, it helps. And then I had him watch the talking eyebrows and he loved it. He started putting his eyebrows up more. My sister-in-law was like, thank you. It makes such a difference.
Oh, that's such sweet feedback. Okay, we'll link the talking eyebrows in the show notes. So interesting.
Yeah.
What are the skills or practices for self-inquiry?
Oh, so you know that term. Because that's an RO-DBT, although maybe you mean self-inquiry with an I, and we do self-enquiry with an E. So self-enquiry, the one we use in Radically Open DBT, is actually based in Malamati Sufism. And so DBT is based in Buddhism. RO-DBT is based in Malamati Sufism.
What is that?
So Malamati Sufism, like Buddhism, is a philosophy, but where Buddhism is more about we are one with the world, Malamati Sufism is more about it's more about introspection and really leaning into my discomfort in order to always be learning and growing. And, in many ways, to becoming more of the person I want to be. So how do we use self-enquiry? It is something it's key in Radically Open DBT. We actually describe noticing energy in our bodies because sometimes, especially when people lean towards overcontrolled, trying to identify emotions is just too much at the beginning. So we just say, notice when you have energy in your body. And when you have that energy in your body, ask yourself, is there something I can learn about me in order to grow? So like, for example, if Susie gives you feedback and you feel energy in your body and you ask yourself, what can I learn about me given the feedback Susie gave me or my reaction to the feedback? The answer is not that Susie is a jerk, right?
Mm-hmm.
It is, what can I learn about me? So, okay, if that feedback hurt, is it possible, just possible? And by the way, I have said, is it possible, just possible, more in the past 15 years than I said in my previous 50 or whatever, 45. Yeah. So is it possible that there's something to learn in this feedback, especially if it upset me? In Radically Open DBT, self-inquiry is leaning into the discomfort, but we have to have healthy self-doubt to do it. Because if we have unhealthy self-doubt, we beat ourselves up. Okay, well, I can learn about me that I'm just a jerk or I'm self-centered or I'm a horrible person. Stops learning and growing.
Yeah.
But if I can go, ooh, I didn't like that feedback. Ooh, that's not who I want to be. So is it possible there's something for me to learn so that I'm not going to be like that?
Yeah. I love that language and where my mind is going. I do EMDR in my practice and I work with a lot of high achieving clients. And there's an element of of EMDR where we look for a negative cognition about the self. And that is very hard for a lot of folks to come by because we want to give my negative cognition is that guy was a blank or that it's so natural to make that connection. But obviously, if it's possible, just possible, that it's saying something about the self, then that is too hot to touch a lot of the time, but can be such an important point of exploration.
Exactly. I can give you a personal example just to kind of like highlight it. There was one time when the senior clinician team with Tom Lynch was all together, and Tom's wife, Erica, was saying to everybody, Tom's wife said just to me, Ellen, your one-day trainings are getting such amazing reviews. You are knocking it out of the park. People are wanting to learn more about RO-DBT. You're doing such a great job. And Tom then goes, everybody, you're all doing an amazing job. All of your reviews are awesome. They're all wonderful, and he goes on. And then we go on with whatever we were doing. And then a couple hours later, we were sitting down to do self-enquiry together. And Tom asked, is there a time over the past, day or two where you felt energy? And I raised my hand and I was like, yeah, I felt energy when Erica gave me this lovely compliment and it felt like you took it away. Like, it wasn't something about me and I'm working really hard and I really, and I felt like you just kind of took that away. And Tom looks at me and he says, which this is an example of self-enquiry. He said, Ellen, I just have one question for you. What is it that makes it difficult for you to celebrate the success of others? It felt like he kicked me in the gut. And that is what tells me I'm at an edge. And what we describe in RO-DBT is an edge of learning, an edge of growth, right? And so I could go, oh my God, I'm a terrible person. That's horrible. What do you mean I don't care about the success of others? But with healthy self-doubt, I go, oh God, is that what I'm signaling? Is that what that's not who I want to be. That's not in line with my values. And then I recognize, it is true when other people get recognized or awarded or whatever, I go, why not me? And that's not in line with who I want to be. So because of self-enquiry, now I can recognize, okay, that shows up. And I am a person who wants to celebrate the success of others. So even if it still pops its little head up, what about me? Or I want to be special. I can recognize that and go along with my values, which is to just lavish in the success of the people that I care about. Does that make sense?
Yeah. Yeah. I mean, I think it sounds like the powerful piece of that self-inquiry is when you realized that there is maybe a connection. There's a thread between other situations. And that one with no context, you might not have had the information. But when you took that moment of self-enquiry and thought, oh, I do have some energy, to use the language around when other people are being celebrated, that seems like the really powerful element of it.
Exactly. Right.
Would you say between DBT and RO-DBT mindfulness is similar, or is it approached differently?
Mindfulness is still mindfulness, and there are some things that are different for sure. So it's observe, describe, participate, non-judgmentally when mindfully and effectively. Those are all tweaked. The what skills and the how skills are tweaked. So the what skills is observe. What is it? Oh my gosh, I can't believe I'm forgetting it right now. Tom Lynch would kill me.
Just because you're on the spot.
I know. I can tell you it's describe with integrity, with the awareness continuum, which is something I love, because in describing with integrity, we say, I am aware of a thought. I am aware of a feeling. I am aware of a sensation. I am aware of imagining, which enables one to take accountability or responsibility for what occurs inside of us without insisting it's the truth. So it's like, if my husband goes downstairs to get a glass of water and doesn't ask me if I want one, and he comes up, I might say, I'm aware of the thought that you didn't think about me when you went down to get yourself a glass of water. I am aware of the feeling of sadness and the feeling of thirst. Now I know that sounds a little forced, but what it does is help to say, this is coming from me.
Yeah.
Right.
It separates the intent or your experience of being disappointed from their intent in some ways.
Right. So that's the describe piece. And then the participate is participate without planning. Because as you might imagine, when people lean towards over-control, planning is a very key factor.
Sure.
And that leads to people not wanting to be spontaneous or, needing to know every little detail. And that gets in the way of connection. And so we do participate without planning practices where all of a sudden we'll be like, okay, everybody up and do what I do. And you act silly for 30 seconds and you get back down. And that just exposes people actually to having fun before their self-consciousness kicks in.
Mm-hmm.
So that's that. And then instead of non-judgmentally, in RO-DBT, we say, be aware of harsh judgments. Because the idea is when people lean towards over-controlled, they have high detail focus, high threat sensitivity, again, see mistakes and problems everywhere, by the way, especially in themselves. And it is impossible to take away all judgment. So it's just notice the judgments that get in your way. And then one mindfully, same thing, with self-enquiry. So that's been added into mindfulness. And effectively with humility. Because people who lean towards over-controlled are often effective. Mm-hmm. What they need, though, is to loop in that with humility piece. Mm-hmm. And then I think I mentioned already, the mind states are different. So instead of emotional mind, reasonable mind, and the wise mind, RO kind of goes, most over-controlled people don't really struggle with emotional mind in that way.
Right. They live in a
reasonable mind. Right. And so you have instead the flexible, the fixed, and the fatalistic.
Mm-hmm.
Yeah.
Okay. You mentioned that sort of getting up and doing something playful. Is that the playful behavior element? Oh,
yes. I mean, in RO-DBT, one of the things I love about RO-DBT is I get to tease my clients. Mm-hmm. And as you might imagine, when people, again, lean towards over-control, they're often not comfortable with teasing.
Sure.
And we actually teach our clients how to give a tease and how to take a tease. Because a tease is a loving way of giving feedback without rubbing your nose in it. Mm-hmm. And it's an important skill to learn.
Mm-hmm. Can you give an example of a tease you might do as in your practice?
Like if a client comes in and says, well, I did the assignment that you had asked me to do, and I actually read into the next lesson, and I really am finding that helpful, so I want to keep moving forward. And a tease might be, of course you do.
Right. That tracks.
Exactly. So it's kind of like a gentle way of giving that feedback, right?
Yeah.
Yeah. Or another example, I might talk about the difference between over control and under control. And if I'm saying something that I think relates to you, I might say, maybe sounds familiar to you? Give a little wink, right? Like,
Yeah.
I see you and I care about you.
Mm-hmm. Yeah, I can definitely see how all the elements that you mentioned would be part of a really great treatment
Yeah.
process.
Right. Yeah.
Um, you had mentioned a screening tool earlier. Are there any others that you incorporate into your case conceptualization that might be off the beaten path or that some of our listeners might not be familiar with?
I mean, there are several questionnaires that we use in the Radically Open DBT camp that can be very helpful to understand, one, which way you lean first. Do you lean towards over control or under control? But it doesn't measure psychopathology. It's just which way you lean. And,
Yeah.
it's self-report. And by the way, one of the things we recognize in Radically Open DBT is that when people lean again more towards that emotional over control, it's on a bell curve. So when people lean towards more towards that over controlled side, they actually tend to be not reliable self-reporters.
Sure.
Why? Because they want to present themselves as doing better and as feeling better. And I even have a colleague where the whole understanding of her over control saved her finger because it was bitten by her cat. I don't need to tell you the whole story about that, but she got an infection in it from a puncture wound. When the cat bit her, she didn't think much of it. She cleaned it and went to bed. The next morning, woke up in pain. Her finger was swollen. It was red, like a good little over-controlled person. She went to work because that's what you do and didn't complain about it, nothing. She ended up, it started getting worse. And then people at work were like, you need to go get this checked out. You have to go. So she did. She went to acute care and they sent her to the emergency room and they put her inpatient and started her on IV antibiotics. And she was there for 3 days. And every day they came by, it still gets better. They came by and they said, tell us your level of pain. And she rated it like a 2 or a 3 because she is a tough little over-controlled person who was able to hold in her pain. And then the 3rd day they came by and they said, we're trying to determine if we're on the right path or we need to switch things up and actually take you to surgery to clean it out. What is your level of pain? And she went, oh my gosh, I'm being over controlled. And she told them it was an 8 or a 9 and they took her right into surgery. So,
Wow.
that awareness. Yeah.
Yeah. Great story. Your mention of self-report goes back to the husband who
Right.
said, why would anyone fill out this side?
Exactly.
Obviously, there's a good side and a bad side.
Exactly. And there are some people, though, who take the report and they're like, oh, I think we're supposed to be balanced. So I'm going to do it. And then they finish taking it and they're like, I'm almost perfectly balanced. But the numbers are actually off by 1 so that you have to lean one way or the other.
Oh, that's awesome.
And it's like, do you think being balanced is good? Because we even say, who do you think's better? Who would you rather have around, OCs or UCs? And the reality is, very often people will say, well, OCs for sure. We need all of us and all of our different traits for a variety of reasons, right?
Yeah.
And one is not better, just different.
Mm-hmm. Yeah. I'm thinking of a friend group. You need someone to plan the trip, but then you need some people to enjoy it.
To be spontaneous and help you. Yeah, exactly.
Yeah, lighten the mood.
Yeah.
Are there group elements to RO-DBT in addition to individual?
So in that way, RO is structured just like traditional DBT. So it's the, 1 individual session a week and a skills class, ideally 2.5 hours a week. Although out in the real world, a lot of people lengthen how long it takes and only do an hour class. So yes, there's an RO skills class, and we call it a class, not a group, for a variety of reasons. But one is overcontrolled people are more comfortable in class
In a
settings.
class, yes. They might resist a group therapy setting,
Exactly.
but a class would be right up their alley,
And,
right
and
up our alley.
and it's the table in the middle, and you all have paper and pens, and you're learning the skills. Yeah.
Mm-hmm. Yeah, that makes sense. So you had mentioned, you gave us a little teaser earlier about sort of the process to learn this modality, because
Mhm.
you mentioned that you do one-day
True.
trainings. What if someone was intrigued after this, what would be a good learning path to pursue to be able to use RO-DBT effectively?
Yeah, that's great. Great question. I would say check out the website, radicallyopendbt.net. That is the official Radically Open website. All of the trainings that are part of Radically Open DBT are listed, scheduled. So you can do one-day trainings, which you're just getting a flavor of it, but you certainly wouldn't be an RO therapist. And then you can
And
do.
you offer those, it sounds like, through that website that yours would be on?
Well, I don't have any currently. I mean, it's just something that I will typically, if someone comes to me and says, hey, our organization would love a one-day training.
Oh,
Would you
yeah.
come do that? And we can invite other people. And I'm like, sure, yeah, absolutely. So
Yeah.
that, but there are recorded trainings, and there are ones that are done in person. And so there's level 1, level 2, and level 3 in RO-DBT. Level 1 is just like the one-day training, just gives you like the excitement about it. Level 2 is where you really learn all the theory and all the practice that you can do fully online. And it's all Tom Lynch teaching all of the skills. And then after you complete level 2, ideally you do an in-person level 3, where you're together with a bunch of people learning more of the nuances of the treatment.
Okay.
Yeah.
And then did you had to be a trainer?
Mhm.
Do you have to do
Then you go on more. Yep. You
Yeah.
can become an RO-DBT scholar. Then you can become a senior clinician, which is where I am,
Oh,
yeah. So
how neat. And I know that you've worked a lot with eating disorders. You even have written 2
yeah.
manuals about RO-DBT and eating disorders.
Actually, one's DBT and one's RO.
Oh.
Yeah. And then, so one's DBT for bulimia, one's RO-DBT for eating disorders, and then the new book coming out in August is RO-DBT for anxiety.
Oh,
Thank you.
congratulations.
Yeah.
How neat. Are there other common maybe diagnoses that you see working very effectively with RO-DBT in addition to
Oh, for
eating
sure.
disorders and
Yeah,
anxiety? Yeah.
absolutely.
OCD, I assume.
I mean, OCPD for sure. Um,
Yes.
Absolutely. A lot of personality disorders actually
Yeah.
fall more under the overcontrol rather than the undercontrol, a majority of
Yeah.
them.
Yeah. Narcissism.
Oh, yeah. Depression actually was the first illness that RO-DBT was studied with. So it was depression on the geriatric population, and it was wildly successful. So chronic depression, where people had tried the traditionals and nothing was helping. And it turns out it was deep-rooted emotional loneliness.
Oh,
Yeah.
yeah.
So a lot of disorders. And, RO, like DBT in many ways, is transdiagnostic, meaning it's treating what underlies the diagnoses, not actually the diagnoses themselves.
Sure.
Right.
Yeah. I heard you mention earlier that pathology aside, so
Right.
it's not necessarily that people are coming to you for
Absolutely.
the diagnosis. This sounds like some pretty core childhood beliefs that starts
Well,
the path to
I mean,
overcome.
temperament is genetic. Temperament is
Yeah,
biological
that's true.
piece, right? So
Yeah.
everybody has their own biology, and then life experience kind of shifts it. So one of the examples that we often give is, you have that genetic, which is I'm threat sensitive and I'm detail focused. And, so imagine a little boy named Johnny who's highly detail focused, highly threat sensitive, low reward sensitivity, invited to a party. Does he want to go? He doesn't, right? Johnny's about 6 years old. And he goes to the party because his mother's like, honey, you need to go. It'll be good for you. I promise. Because she
Opposite
knows,
action.
right?
Yeah.
And she knows he needs friends, right? So they go to the party. And lo and behold, I typically say, what do you think happens? And people will say, Johnny stuck to his mother or Johnny went and had fun. Neither matters so much as what do you think Johnny's friends said about the fact that Johnny's mom was there?
Oh.
Right? Johnny's a baby. Johnny needs his mommy. And so what did Johnny learn? Johnny learned to control and mask his feelings. Johnny learned if my mother sees my anxiety, she's going to try to fix it and she's going to make it worse. So I need to mask my anxiety, right? And that's just an example of how the biotemperament with the experienced living leads to that, right?
Mm-hmm. Yeah, that's a great point. That's a great point.
And by the way, the bell curve, I'm sorry.
Yeah.
I just want to mention the bell curve, over control to under control. In the middle of the bell curve, we have what's called flexible control, which is where you and I lie, meaning we can pull on traits from the other side, right? So often, by the way, Tom Lynch has done this, he gives questionnaires and everything to the people who do his trainings. 80% of clinicians are over-controlled. And yet, when they're home with their loved ones, they can be playful and silly. Why? Because they're in the flexible range where they can pull on traits from the other side. So it's only on the tail ends of over-control and under-control that can be problematic. And still learning about your biotemperament can be extremely helpful.
Yeah, I love that point. Where can folks find you and how could they connect with you if they're interested after hearing what a great wordsmith you are?
EAF ReCenter is my company, my website. Ellen, you're welcome to email me, Ellen at EAF-ReCenter.com.
Yeah, I'll put it on there. I'll drop it. And then I've got to ask everybody this just to keep with the title. What do you recommend for self-care, or what do you find is helpful for yourself?
Oh, that's wonderful. Honestly, what I recommend for self-care is learning your own temperament so that you can take care of your temperament. Meaning instead of judging yourself for who you are, however you view those traits, view them as what makes you special and then work with it.
I love that. I love the bell curve analogy too, that when you're flexible, you can pull what you need
Exactly.
when you need it by getting to know your own temperament and how you lean.
Right. Exactly. Yep. And it, by the way, also helps you interact with people that you love. If you understand their temperament and your own, just really quickly, I know you got to wrap up, but my mother is over-controlled and I'm under-controlled. And when she used to come to my house, what do you think she saw when she walked in the door? Everything that was out of place, a mess, broken, needed to be thrown out. And then she starts listing them. I never saw them. They didn't bother me at all because I'm under controlled and I see global, I see the big picture. I don't see the details. And I would think she's telling me I'm horrible. So she and I had a long chat about our temperamental differences and said, listen, we see things differently and it's not good or bad. So now when she comes over, she can tell me the top 3 things. Only 3. 5 if it's a really bad day. And I promise that I don't believe she's telling me I'm a horrible person.
See, and that little snapshot of flexibility is really, really interesting and feels so loving, because so often that hard boundary one might try to draw is don't tell me. And to an over-controlled person, it feels like that's her expression of love. She cares. She sees it. She wants you to know. So to give her 3, that almost feels playful, but also like that, just a true understanding of her temperament. Like she just wants to care for you in a way that she knows how.
Right. Yes. Yeah.
So really neat to think about it in terms of parents, because earlier I was thinking of moms of young kids, or just parents with a bit of that over control, and how you learn to let a little child live in a developmentally appropriate way, but that feels really chaotic to an over-controlled person, probably.
Oh, yes. And again, they're already threat sensitive, so you can imagine all the threats that they see.
Yeah. All right. Well, Ellen, thank you so much. This has been so much fun. I really appreciate it.
Thank you so much for having me. It's really lovely meeting you.
You too.
Bye-bye.